The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC. And today I'm talking to Dr. Jarett Berry. And Dr. Berry is an assistant professor of medicine at the University of Texas Southwestern and the first author of an interesting paper that relates the level of fitness to the lifetime risk for cardiovascular death. Now, this is a very interesting study that actually was done from the database of the Cooper Clinic in Dallas. They examined 11,000 patients who had undergone a bulky stress test sometime prior to 1990. Based upon the stress test, they classified the patients as low, intermediate, or high risk for cardiovascular death. They then followed these patients to age 90 and very interestingly demonstrated clearly that the level of fitness on this first bulky stress test did convey a risk prognosis for ultimately cardiovascular death. For instance, for age groups of 45, 55, and 65, they found the relative risk of cardiovascular death between the lowest fitness and the highest fitness was 13 versus 3%, and 34 versus 15% in the 55 age group, and 35 versus 17% in the 65-year age group. So very interesting data pointing to the risk prognosis associated with poor fitness. So Dr. Berry, let me begin by asking you, can we extrapolate these data to the general population? These were largely middle class or upper men.
Thank you, Dr. DeMaria. That's a good question, and that was one of the questions that we had, was to what extent, as you point out, to what extent are these differences in fitness acquired in midlife and the associations with lifetime risk for cardiovascular disease mortality, to what extent might we be able to generalize these? And as you point out, just as with all cohort studies, each cohort has its own particular characteristics. And in an effort to attempt to better understand that, we looked at the effect of just traditional risk factors, cholesterol and blood pressure, and compared that with some of the other work we've done in the Cardiovascular Lifetime Risk Pooling Project, which is a pooled analysis of 17 or 18 different cohort studies. And I think an encouraging observation that we had was that the effects of cholesterol and blood pressure and diabetes, et cetera, in the data from the Cooper Center longitudinal study were actually quite comparable to those observed in the general population and from perhaps a more representative cohort study. So we think that provides, although not convincing proof, we think that provides good supporting evidence that the observations we see in the present study with physical fitness might in fact be relevant for the general population.
So would you say that fitness is a surrogate for generalized risk factors? In other words, if you have high blood pressure and smoke, you're less likely to be fit?
Well, that's another good question. We do see that if you look at individuals with high and low fitness, you will clearly see gradients with traditional risk factors. Individuals who have a high physical fitness in midlife have a lower rate of smoking, a lower prevalence of diabetes, lower blood pressure. And so the question I guess you're getting at is, to what extent does fitness add to traditional risk factors? And in an effort to get at that, we stratify the cohort by levels of traditional risk factors and then also by physical fitness. And interestingly, what we observed was that individuals who do have a risk factor, that the presence of high physical fitness appeared to limit the effect of that risk factor across the lifespan. So we see that it's not just a surrogate for other risk factors, but it appears to be additive and contribute to the effect of those risk factors that are present.
And so one final question, based upon your data, would you now recommend that a treadmill test be incorporated into the risk stratification evaluation of patients?
I don't know if I would go that far. I think I might stop short of additional testing, but I would emphasize that prior studies have shown that fitness is clearly associated with short-term risk for cardiovascular disease mortality. And I think the message from this study is more that fitness is a short-term risk factor, but it's also a long-term risk factor, and it really does influence risk across the remaining lifespan. And so I think what this does, at a minimum at least, is provide some context for physicians and patients and maybe for the public health that exercise in midlife is relevant not just in the short term, but across the remaining lifespan. And the extent to which we actually go about assessing fitness, there are a variety of different ways that we can do that. How long it takes to run a mile might be a good surrogate for one's fitness. And so I think we might be able to stop short of doing a lot of additional testing for these patients. And so I probably would not recommend at the present time that we incorporate active treadmill testing in all patients to further stratify cardiovascular risk.
Well, thank you very much. Clearly, some important data showing that we can use level of fitness to help advise our patients. For Inside JACC, I'm Tony DeMaria.